Hello, hello again. Um, is that any better on the on the audio? Is that any better? Because I have okay. I have spent. Thank you very much. Thank you, Eric. Appreciate it. So here we are again. Let's second time's going to be the charm. You would know because I went back to StreamYard. Just doesn't like my equipment. Hello, y'all. Hey, Brothy, Eric, Tiff, Katie, Krumel, everybody on here. I can't even hardly see it now. Eric, thanks for, I really appreciate y'all coming back. Red and my mods are back, and I appreciate, thank you. Well, I spent my time working on it, or he did anyway. Okay. So, gonna go ahead and say that you're probably, hey, Debbie, how are you? This touches a lot of people a lot of different ways. You don't know what way it's going to affect you. Um, if this topic is too much, please do not worry. Just come back on the next one. I don't want anyone leaving here worse than when they got here. So, but this affects a lot of people, and it truly is a yeah. So I've been going through this weekend and this last week. Well, actually, these last few months. If I started thinking about all of that, but so it does affect a lot of people, and I don't want anyone to feel like you have to stay if it hurts you. Please don't. I would never want that. And if I don't rip up the box, see how that goes. So I'm just pulling one out, and let's see what comes up. Okay. And this is the one that come up. First one, it says, however, there is a bridge between our conscious mind and the subconscious action of the autonomic nervous system, breathing. Don't ask me. Don't know. It's called the butterfly breathing, but I'm not getting into breathing techniques right now because I'm a little sniffly. I didn't like that one. But I don't read them until I read them here. And next thing before we get into all of this. I read a whole notebook last night. Oh my God. I wrote a whole notebook for this and I can't get it open. It's just don't ask. Don't ask. It's like the story of my life. Okay. So before we get into anything and I have some guests here, and before I bring anybody on stage or anything, I'm gonna we got to start at the beginning. The beginning is called medical gaslighting, and for everybody to know who that is, we need to define that, right? So, and I had this beautiful slideshow, everything. Medical gaslighting. Identify that as it's a form of psychological manipulation that occurs when a healthcare professional dismisses, invalidates, or undermines a patient's genuine health concerns. This can lead the patient to question their own symptoms, experiences, and sanity. Tiff, you can? You still can? No, you absolutely still can. I'll drop the link. Hey, Barbie. Tiff, I forgot about this one. You got to know where my head is never at. Let me see. Unless somebody can get it to you faster, I am going. See, I installed the notebook. I have all my stuff. I can't find it. Yeah, I found it. Nope. Wait, medical. But it won't do the transcript. I don't understand why. Okay, so well, I found it. Found it, y'all. Okay, thank you. Yep, yep. There you go, Tiff. Because I was actually looking. I'm trying so slow. I'm actually trying to get this done, and I found the notebook that I couldn't find earlier, but it won't open with the notes on it. I'm not sure. Don't want to go there. No, I'm gonna learn this. It's something new Ned gave me. But I'm gonna learn it. But anyway, so literally, legit, just saying medical gaslighting is a form of psychological manipulation. Same thing as regular gaslighting, right? Okay. That occurs when a healthcare professional dismisses, invalidates, or undermines a patient's genuine health concerns. Okay. So here's the thing. Then they start thinking of, well, is it just me? Am I crazy? Am I, am I sane? Am I sane? I mean, here's this professional. There's a lot of us in here. Okay, Katie, yeah. I mean, you got okay. So some of the characteristics, really quick, because I'm going to get through these really. I just want y'all to understand. There's like different types, and I know that hey, living my best life. How are you, honey? Um, there's characteristics of medical gaslighting. Healthcare professionals may downplay or ignore the patient's symptoms. They may attack. I mean, they may attribute the patient's concerns to mental health. Come on, y'all. To mental health issues or other factors. Come on. I think that's what they do best, right? They may dismiss the patient's report of pain, discomfort, or other physical changes. They may patronize or use dismissive language. Um, let's see, they may refuse to investigate the patient's concerns or order appropriate tests. Hey, Sandy, Wendy. Hey, everybody coming in. Rosie, hey, Grim. Happen to anybody? Did just these things sound familiar? Um, there's big consequences to that of medical gaslighting. Patients may delay or avoid seeking necessary medical care. They may develop anxiety, depression, or other mental health issues. They may lose trust in healthcare professionals. They may feel isolated and misunderstood. I mean, there's patient. Okay, and then the prevention. I'm going to say this, and this is way shorter than what I had, but I have a few people that I'm going to let have the floor. um, prevention and addressing medical gaslighting. Okay, so here's your biggest thing. If you have any takeaways from anything that's said, please remember this. When you're in that moment, you will know it. You will know. Please know that you are your own best advocate. No one else can. I mean, you can have family members, you can have people, but you are your own best advocate. Sure, get everything in place, whatever you feel like, but if you've got to, I mean, just remember that everybody could be in there advocating for you, but you are your own best advocate. Just please remember to be heard. I mean, you are the patient, you are human, you are a human being. Be heard. Don't stop until you're heard. You can seek a second opinion if you feel your concerns are being dismissed. Um, and document your symptoms, interactions with healthcare professionals, and any evidence they have to support their claims, blah, blah, blah. But I don't like the bottom, the prevention and addressing medical gaslighting. This is what did it. Patients should consider seeking support from a therapist or counselor if they are experiencing psychological distress related to medical gaslighting. Hmm. Just saying. Hey, Mandy. Just saying. It's it's all. I just can't. I had so many things, but I'm fixing to bring. Oh wow, Rosie. Hey, thank you, Mandy. Thank you. Okay, so look, I'm going to bring up, first person I'm going to bring up is Fixilla, and I'm bringing up Ned. Hello.
Hello, hello.
Hello.
Were
Oh
you
my
able to pull
gosh.
those up?
Oh, I'm looking at Apollonia. I can't
Oh my
help it.
gosh, I can't hardly see. I'm so blind.
Apollonia.
Oh, she's so
Hey, mate.
pretty. Both of
I
you are.
know. Look at that.
Oh,
She's.
we had
Oh
the
no.
Philly Filler chickens, is what we had growing up too.
Oh, I see it. Here, please.
So pretty.
Where did you send it? Where did you send it on?
I sent you the link for the drive on Messenger.
Oh, I can't get Messenger on here.
No? Okay, let me try it this way.
Can if
Email?
can you email it? It's me. So I said, boy, if it could go wrong, it's gonna be me.
I'll tell you what.
Hey, Maker, hey, Matrix, and copies of it. Yes, always get your medical records, guys. Always. I don't care if you think it is like so. My Aunt Dana was supposed to be in here because I wanted her to tell her what has happened to her. I mean, you want to talk about, well, what she just went through? Mm-mm.
It's so asinine the things that they put us through, and we're supposed to just take it, is the way they act.
But we're not taking it anymore.
Mm-mm.
And that's the point. Hey, Paige, how are you? I'm glad you're back. See, that's the thing. I'm not taking it anymore either. And I'm tired. I mean, I'm literally tired, physically tired, mentally of just fighting the system over and over and over. And this, I've had enough just myself.
Mm-hmm.
Not to, my
Yeah, just the last couple
residents.
of months.
Yeah. Really, something went wrong. Just fixing to get this computer thrown out the window.
You should get it now.
Yeah, mine's just like, I don't know. Oh, what happened, Paige? You're making. Oh my gosh, everybody. Oh wait, yeah, everybody's in the hospital. Tiff, where you at? Oh yeah, I gotta bring Tiff up. Hey Tiff, you there?
If
I'm sorry. I'm trying to work over here and fix everything that I can't. Where'd you send
Yes.
it to? I'm sorry. Where'd you send it to?
the MHM to us.
Oh, okay. Let me see then. Updates. Nope. 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 And
What
nope.
in the world?
And this is what I'm telling y'all. Hello. Nothing is ever gonna go as planned. Hi, Sophia. I'm just gonna laugh and keep going. I mean, what else am I gonna do? Mercury's in retrograde, for the love of God. My life, my life's a living hell. So
That's
let's just get on with it because I can't get any of the information that it was so proud of.
that's always when I know something's going if something's going on in my life, I'm like, where is Mercury right now? Because
I'm not the only one.
no.
I'm not the only one.
So,
Okay.
Key, I sent it, but you want me to just present it? You just tell me when
That
you're
would be
ready. And
great because I mean that would be great because I mean like literally the nethers tonight don't come through or nothing. Just
okay.
don't. I mean, why would it? Let's go to spam. If it puts you in spam, it's gone. No, it didn't.
Spamming me. Oh,
It didn't spam you. It
okay. Give me
is
just a
not.
second. I'll get it pulled up.
Okay, so I'm gonna go first. First thing I want to do is hey Heather, welcome. Hey, lovely, lovely. Oh, okay. Thank you for being. Yeah, everybody. I'm a body illusion. I'm sending up my prayers for because yeah, she needs them, and it's not the same without her. Oh my God. There's some. I can't even look at these emails. It's so weird. Anyway, hey pup groomer. Yeah. Yep. Currently going through that myself. And when you're fighting. Okay, so when you're or advocating. I say fighting, advocating, what the hell ever. When you're doing that for someone else, like, it's different than doing it for yourself. So I wanted Six to, she's went through one, as probably all have, but we don't compare traumas. Everybody's is unique to their own and just as
I don't know,
detrimental.
Keela, mine's worse
But
than everybody's.
come on.
It's not. They all suck.
I love
You
you.
can win if you want to.
No, it's
There's no
yeah.
winning, right?
This is not something I want to win out. That was one of
Right.
my biggest pet peeves when I was sick. Was people would start talking about themselves and they'd go, "It's nothing like what you had." I mean, it's nothing. And I'm like, no, no, no. My worst day feels just the same as your worst day. Like it doesn't really matter.
Pup
They
Grandma.
all suck.
Yeah, so I wanted her to tell her story really quick. She's got some things that I had never heard before. Of what, Heather, you get this a lot when you're overweight. My husband has horrible back pain for years. Oh, you said it. It took 6 doctors before I looked past his weight to realize that. Yes, thank you. Okay. So honestly, it's across the board. It's across the board. But I'll just give you one guess as what gender is affected by it the most. Everybody can answer
Yeah.
that one.
Ladies.
Well,
Women,
and black women,
get it the worst.
yeah.
Yes. Yep. If you start breaking it down by, that's right, Kate. You start breaking it down by gender, then it goes socioeconomic, and then it gets even worse than that. I mean, it gets so bad that it gets back up to the high suburbs, and people like Maya's never going to have a mom again. It I don't like it. I don't like what I'm going through with it right now, and things we had to go through this weekend. But Six's story is just like it makes me just feel like I could just sit back and go, damn, I didn't really have that bad. But I mean, it's true. Everybody has their same, we all have rights, but sometimes we have to be our own advocate.
Yeah.
Okay, Six, I'm sorry.
100%. No, I don't know. What did I say this morning that was so profound? I was just, blowing out my ass, probably.
You're talking to somebody who
I'm
has
to
no
the point
memory.
I've had to tell my story of being
Yeah,
sick so
no.
many times that it's like I've workshopped it, that I can kind of tell it as like a comedy routine almost at this point.
You
Because they
gave me the
used
short
to,
version,
I
but did
agreed
y'all?
to every trial, every like research
Yes.
study, anything they ever asked of me, I've 100% said yes. So, you know, you get used to having to tell your story over and over with those types of things. Um, but I guess one of the things we talked about this morning was that I was lucky enough that I found one resident doctor
Yes,
that
that's what we were talking.
was
Yes.
that was willing to like not look over me and not look through me. And for him, he was a young resident at the time. It was a medical mystery, and 12 years later, he's still my primary physician. He runs the program that was a part of, and still treats me, even though I no longer live near him. I go every 6 months and see him in person so that he can treat me telehealth the rest of the time. That's how much like I if he moves to Norway, I move to Norway. Like that's like I
You
wouldn't be
can't get,
alive if it wasn't for him. And
and you don't find that.
I forget. Like when everybody was freaking out during the pandemic, I was like, "What do you mean? Just call? Don't you have a Micah that you could just call and ask? Like, don't you? I mean, you don't just text with your doctor and like I did the landscape plan for his house. Like we've just become like, if when you're with somebody that much, because he was
But
able to be
you,
my hospitalist too. So it was him and
yes.
I
Yes, I say
against the world.
yeah, I mean, and he stuck with you, but he saw something that nobody else would just stop.
Yeah.
and stop and take the time and look around, And as a paramedic, we're when you go on a call, we don't have that luxury of spending time. You got to survey that area. You got to figure out what happened. You got to figure it all out in your head really quick, or take mental pictures and get on the patient and try to figure out what happened to him if they can't, or her if they can't tell you. But you have to use just what you can use while you have it right there, and then you're
Yeah.
gone. And that was always the weird part about it, because if it's trauma, you're trying to figure it out, but you don't have that much time. But when I worked in the hospital in the ICU, I had the time to be able to do that, because I got so sick of watching all of these families I didn't know the term was gaslighting. I didn't know what term to use for it. I just know that I worked in this field that's supposed to be helping people, and it's not. I see families distraught out here. I see, this is stuff that could be prevented or at least lessened. And then I became the patient. And now I understand why 6 keeps her doctor and is not going to let loose of him. My doctors, I love my doctors. My doctors, because they do your mental and your physical. They believe your body's all one, and you got to treat the same thing to make it all work. Because if you get pneumonia, your psych meds quit working. If you get a UTI, your psych meds quit working. My facility, their psych meds don't need to stop working. So,
Yeah. Neither do
but
mine.
yeah, but see, so
No.
did you find a way let me ask you, did you find a way that you could make yourself was there a breaking point that you finally just stood up and said, okay, this is what's going to happen?
Actually, this morning I think I said something. I was in an ambulance for like the 16th time in like 2.5 months.
Yes.
And they were driving down Interstate 94 in Minnetonka, Minnesota, and they couldn't get a vein. They were trying to go in my feet. I mean, they were doing all these things because they couldn't get a vein. And I was like, this is bullshit. And when we got to the hospital, they did all their stuff. The next day I talked to my doctor. I'm like, here's what's going to happen. First, we're going to put in a portacath, because this bullshit on the freeway is not going to happen again.
That's where
And
you
then I
stand
just,
up.
yeah. And I was like, because nobody wanted to admit that there was a problem to justify doing it at that point. And I'm like, I don't know what else. They didn't have a official diagnosis that they were 100% confirmed on, so that nobody knew what to do. So, but
Right.
that, and then that was when, because then I could take care of myself a lot easier too.
Right.
It actually made some of that stuff easier.
Yeah, you didn't have them coming. I mean, your arms, it's one
Yeah.
port, so it wasn't in a way.
I mean, I still have scars from them, but they're
Yeah.
so light now. But
Yeah,
they were the
Crystal,
best. I don't mind the scars, because they
right.
getting that in pretty much saved my life.
Yes. Thank God.
That
Thank
and
God.
having a doctor who fought for me to get into the Mayo Clinic.
The Mayo Clinic. Yep. Thank God for the Mayo Clinic.
Yeah, one of the
Okay.
reasons I agree to every single
to
any
help them.
research study, anything,
Hey,
I'm like,
Thomas.
they're like, we're wondering, you're at the Mayo, they come and they find you, and they're like, we're wondering if you'd like to participate, if we could have a vial of your blood, and this is all it's going to do. I'm like, yep, here you go. While they're having surgery, could they take out a cup of your bile juice from your pain? Yep, sure, whatever. I mean, like, because somebody else said yes to all those questions, I'm here, I'm alive. So I'll say yes to all those questions for
Right.
everybody.
Good one. That's good. Yeah. Thank you. I'm going to bring Crystal up, but Tiff, okay, so give me your, okay, Tiff.
Oh, you want me to go?
No.
Okay. Well, like you, I worked in the emergency room, and this was before I got diagnosed. But I did see some medical gaslighting. I didn't, like you said, didn't realize that that's what was going on. Like, I didn't really realize that's
Yeah.
what was happening. But after the fact, I could see. For me, it started out that I was having a difficult time seeing. My hands were numb. I was having a hard time gathering my thoughts, and I eventually I stopped walking. I got into the bathtub, and I couldn't get out, and
Oh
so
gosh.
we called the squad, right? And I remember that night in the emergency room, that emergency room doctor said, "It sounds like MS." Like, I heard him saying that off in the distance, but he never said that again.
I
And
don't understand that.
um
Oh my gosh.
so I was discharged in a wheelchair. Like, now it's like a normal thing that you live in a wheelchair. I didn't realize that's how I was going to be treated for the next few months.
Right.
But because I showed up in a wheelchair, it was okay for me to leave in a wheelchair, where I continually was saying there's things going on. I remember saying, this was one thing that still pisses me off to this day, sorry, was I'm like, it's numb and it hurts, right? I would be like, oh, it's numb and it hurts. And they were just like, well, what is it? Is it numb or does it hurt?
That's
And if that's just not the primo of totally medically gaslighting me, I'm like, well,
I would say it would.
because you just made a great point. While I'm in the total midst of confusion,
Hey,
my
Crystal.
my body's not working at all.
Right.
Uh and so
Makes me-
eventually nobody was helping me work, helping me get better. And then I had to do a psychological evaluation.
What came next on our list?
Yes.
Yay, you got to fit all your bingo cards.
Is she in touch with reality? Which really, like, at that
Sophia, that would be the greatest thing if people could learn it. I promise you.
Yeah,
You
right?
can't make anybody do that. That's what we're up here screaming.
No,
Yes.
yes. And it was just, and so that just almost felt like such a gut punch, because feel like I'm losing control of everything. I mean,
Mhm.
really, from like my waist down, we were having lots of problems going to the
Right.
bathroom, couldn't walk, different things. And everybody was just blowing me off. And then I had one doctor tell me, because then we were asking about MS, my
Mhm.
family was kind of asking about, what about MS? And he said to me, if I thought you had MS, I wouldn't even tell you for the next 5 years.
What in the hell?
That is exactly what he said. Even
Holy
if I
crap.
thought you had MS, I wouldn't tell you for the next 5 years.
Wow, Tom.
And within that next 5-year period, I had 2 exacerbations.
Mm-hmm.
And so I'm still at home in the wheelchair. I finally get them to do a physical rehab. They weren't looking at the neuro at all. It was just physical, which luckily I could do, but still not listening to me, right? They're putting me through their programs, still not listening.
There you go. Still not listening.
Still not listening. And eventually I took all my very first scan I had, Keela, I took it to the Cleveland Clinic. They're similar
Mm-hmm.
to like the Mayo, where they
Mm-hmm.
do everything. And
Absolutely.
she looked at my scan, and within 2 minutes, I remember my appointment was like 3:15, and by 3:17 I was diagnosed with MS.
What?
Yes.
Okay, so you have no fallback on what those other doctors told you?
No, nothing consistent. I was trying to find every neurologist in the city at the time. I was going to different groups, taking them my different things. And
Yes, Crystal, absolutely 5,000% it has.
To which part?
But the what I'm sitting here with the COVID
oh
vaccine.
yes, that's
Yeah,
No,
and that's
I
a
was going to
thing.
say, because I also said that mental health
the
doctors
mental health
like to do
gaslighting
the,
is the
yeah,
mental health gaslighting is
yeah.
okay. So I have to deal with that every day, and but the
Mhm,
other one, and I don't want to get knocked off. I don't want this video getting knocked off.
mhm,
But that thing right there, I'm going to tell you this. I didn't
mhm.
take it. I did
I
get COVID
refuse.
6 times. I refused. I lost a job because
Mhm,
of it. Medical field. I don't care.
Yeah.
yeah.
But I mean, I got COVID. I had it 6 times. There's nothing I could do about that. Okay, so I'm supposed to have all these little immunities. So, well, if they would quit making the virus mutate, it would be really simple to get rid of. Stop making vaccines that don't work because all you're doing is making it live. It just wants to
Yep.
live. That's the sole
My
purpose.
my sister's ex
But
husband, the
now me
doctor,
having
he's
it have it that many times, now
mm,
I'm on the COVID injury
mhm,
list.
yeah.
Hey, carry on. Hey,
Yes. And
Yes.
then the
I
long
love you
COVID.
guys.
and I've been through the long COVID long. Yes, and now I am now
Mhm,
at just an autoimmune that I've
mhm,
never had in my life, with the thyroid disease I've never had in my life. That all
Mhm,
just happened to turn all this way in one day. Come on.
mhm.
And now I have autoimmune and having to take immunosuppressants. That's what sucks. So yes, I have been gaslit and gaslit and gaslit until I thank God, 1 in a million,
Yes.
I have a neurosurgeon that looked at me
Yes.
and that listened to me.
Well, eventually there came a time, I don't mean to take more
Oh, go
time,
ahead. No, I didn't mean
No,
to butt into
absolutely.
you.
but there actually came a
Okay.
time once I've racked up the autoimmune illnesses since I've been diagnosed with MS. But there was another time where I wasn't
Have you,
I
Patty?
was starting to not walk again, and nobody was taking me serious again. And so this time I wrote up an email and I sent it to all of the doctors and nurse practitioners in my chart, just a blanket email
Tiff,
to
you're pulling a
all of you.
Keela. Good job.
I'm just like, listen here, I'm sick of this shit.
Good
All
job.
of you are supposed to be my doctor, and not one of you give a shit. I just had enough. And it was the nurse practitioner who ended up calling me, the only one I heard back from. And I stayed with her as long as she was there in neurology. But yeah, sometimes it's just that's something I had to learn the
Okay.
hard way.
Thank you for coming on, though. Thank you. I appreciate
Yeah.
it so much. Thank you. Hang on, Tiff. Hang on. No, I'm not talking to you. Too. Six. Thanks for coming on. Your story is unique, and I'm thankful that you're here. So I just wanted you to know that. Thank you for coming on, and I appreciate you. And I love Apollonia.
Yeah, I've only got a
Oh,
couple of
she's the
minutes too, but I just
Okay.
wanted to
All
come
right.
up and support and say I love you. And not all doctors are bad. My
No.
my ex brother-in-law, he went to bat and like literally told the doctors in California, "This is wrong with my wife,"
Carry
because they
on.
were misdiagnosing her for a year and set him straight. So not all doctors are bad, but that's why he quit practicing
Yes.
general, because he got tired of it and opened up a outpatient drug rehab
Yes.
facility in Pennsylvania, because he was tired of dealing with big pharma and all of it. And that's where we lose all of our good doctors, because they're so tired of having to deal with it and not actually be able to help patients.
Yes,
So
they're
that's just about everybody that I know.
well,
Yeah.
yeah.
They're sick of taking interest. Yeah, Hot Desert Chicks before you leave. Yes, talk about how hard it is to get mental health treatment sometime. We will and come up with a
Mhm.
fix for it. I'm all for that.
Uh,
Um
so I
but
love you guys, but
Crystal, thank you for coming on here. Thank you. I mean, like
mwah.
literally, it's time for us to stand up and start taking our
Mhm.
lives into our own hands, because I'm sick of insurance companies
Mhm.
telling doctors how to be doctors.
Yeah, I
Yes.
agree. We will talk more on this subject soon, but I have to jump in the shower. Matt's almost home. Love you
Thank
guys.
you for supporting. Love you. Thank
Love
you. I
you,
appreciate
Always.
you.
Bye, Crystal.
All right, Ned.
Well,
Okay, I
first
can go
off,
too, right?
No, Tiff, you're good. You're good.
I have this ready. I just didn't want to interrupt.
No, go ahead. No, I was just telling Tiff she didn't have to jump down. Not unless she wanted to. Go ahead. Okay. So I don't know. I read some parts of it. Just whatever you can, or do you need me to do it?
Yeah, I need you to do it. I can't read
Okay.
it
You
right
need me
now.
to do it. Okay. Hang on. Oh no, not emotional dysregulation. I needed the one I sent about
Oh gosh.
medical gaslighting.
What was it?
The medical gaslighting. Didn't I send it back to you?
I don't think so.
Oh God, I sent it to somebody. I can't remember. But I can't find it.
I don't
Okay.
think so. Let me go back and look.
Damn. Come on,
Let me
y'all.
see.
Somebody start telling on myself. Who did I talk to? Who was I talking to last night? Who did I send it? Come on, y'all. Is somebody in this chat? So, all I talked to. Come
No,
on.
I've got the. Nope, I don't have it.
I sent it and I don't know how I sent it.
Well, dang. I thought I had you good.
It's on the Google. It's on the okay. So you sent me that notebook, right? And then the notebook
Mm-hmm.
it doesn't have an app, right? Does it have an app?
Yeah, it does.
Okay, let me see. Let me check something real quick. Let me just check something because I mean it should be here because I bought the whatever. So let me see because I really liked it.
And Bracy, that's a whole nother set of conversations we could have, right? On how much insurance dictates our care.
Oh
And
my God, yeah.
I'm sick of insurances. I went in March with the let doctors be doctors. Had the hashtag. Yeah, leave it
yes,
to me.
yeah.
Okay, so I can't find it. Don't know where it's at.
So I sent you the link to a notebook, and that should pull it up to where that you can pull up on your
Oh, it
account.
should, huh? Yeah,
Mhm.
should.
And then if you want to get in the practice of sharing it to that drive, then everything will be right there, and we can continue to keep it all put in. That's what I'm starting to do for everything.
I didn't even know. I don't even know what I'm doing on here. Like this stuff is. I have to
Yeah, I
get
just showed you that last night.
Yeah,
I hadn't
and
heard back, so
and
I
I
didn't know
actually
that.
put it. Well, I put it all together. I put it all together, and I shoved it through. Oh yeah, it went somewhere else. I just can't
Where
remember
did it
where.
go?
I don't know. One of the 5,000 AI apps I have downloaded.
We're going to get organized one of these days. I'm telling you, some way, somehow.
It's hard.
It is.
It is
There's
so
so
Patty, I
much
love
out
you.
there.
and
There's so much
also
help, so many resources, and then by the time you find what you need, then they have to do passwords and this and that, and then it
I
just throws you
know.
off, and then you can't find it again because you don't know where you were.
I
Or at
know.
least me.
And I
No,
don't know
this is
about you guys, but I'm also still paper and pen and computer.
I would be, but I keep losing my paper and pen.
Oh,
And
okay.
so the computer's a lot bigger and it's a lot easier to keep a hold of, just not the inside parts
True.
of it.
Oh
True.
my God, did I find it? Did I find it? Did I find it?
Eureka! Yeah, with it last night on the notebook. You
Secret.
know what? Let me
There's
see.
only 2 pages.
I
Uh-oh.
won't remember. And I won't remember. It's in my computer.
It took it all. I found this one. It's just oh well, it's something. Probably already read it. It's one password. I mean it's one freaking sentence, guys. So let's see. So real quick, the medical gaslighting causes in solutions, and I lost all my work, obviously. So it is what it is.
It's frustrating. It
first-
takes you back to where that you
It's
can't work
okay.
forward.
I print mine out usually, and I wasn't able to print it, and this is what makes me so nervous wreck, and I'm trying not to be now because I had this actually where I could switch it over and I could make I could have made it the podcast. So it was so cool.
Yeah, it's like what I
But
had, I did the
now I
self-identity
can't
one.
do anything. So I even changed it over there to the studio conversation mode. There's a lot with this last night. It's
Yeah, the
gone.
interactive mode, you can ask questions to
Mhm.
the podcast hosts.
Yeah, I mean, this is so freaking weird. Yeah, I'm going back to the paper, pen, and physical books. I'll lose everything. Okay, so, um, oh well, I mean, I've already pretty much said this on medical gaslighting causes and solutions. The first, it says the first source discusses medical gaslighting, its prevalence among women. Who would have thought that? Huh? Come on now. Who would have thought that? And its causes, including gender bias and physician shortcomings. It provides examples of gaslighting and okay, yeah, that's our source. It would be great if we had all that. Ways for
So-
patients to advocate for themselves. That's what I keep saying. Patients, I mean, everybody, we all have to stand up and advocate for ourselves. Damn it, if we don't want to take that, we don't have to. If we need something, we need to say we need this, and not have to be made feel like we're seeking drugs or we're hysterical. Is the main reason, women medical gaslighting. And it just says right here on this one, it says, yeah, get a second opinion, which is worse than anything because it's hard enough to get that first opinion. Bring someone with you to the appointment that can hear and write down things that maybe you're not hearing or writing down correctly, or
Right.
maybe you've already got this bias in your head that they piss me off, they don't help me, they don't want to help. So I'm just gonna, our minds, when we are emotionally thinking, we're not logically thinking. So bring someone with you that can just maybe record what was said so you can go back.
Yeah.
That's what I
But
did. I
both,
did a lot of CYA with Bradley, and then it was right around the same time that everything hit with COVID, and I wasn't able to go. I had to drive him up to the driveway at the emergency room and watch him walk up through the emergency room doors because he was going to stay in the hospital that night. And he came out with a PIC line with any information on it at all. And at that time, there wasn't any that I could find on YouTube even. And I just knew that I had to keep it clean. And I had no training whatsoever. I had to flush it out every day. And my God, the gaslighting that happened from the government, from the medical institutions, from everyone. Bradley and I both, I mean, you hear me, you see me recently where I'm at. And it's a combination of all of that. Plus, other stuff, obviously. But a big part of my dysregulating was because of that time. And I completely lost myself. And I'm still struggling with it. He needed an advocate. I couldn't be there. Then through all of that, I ended up needing an advocate. And we've got to find a way. We have to, because where I'm at, I really I've got to find one for many different reasons. And he does too.
I told you. And the way that, okay, so here I was pulling up some stuff on here. There's so much information that there's so much of the information that I'm reading. Hang on, I'm sorry, Patty. Yeah, because I don't know. Yeah, everybody. I'm sorry, Patty, all of you, because look, let me tell you, if we don't stand up and don't start saying this is what it is, you can either give me another doctor or I'm not leaving until you do. I mean, what? We got to go burn our bras again, ladies? Come on. I'm just saying.
You
Just
asked the question, Keela.
I mean, I kind of feel like that right now because I'm going through
Bradley's
the same
at that
thing.
point.
Hey, Hamina. I'm at that point. Yeah, I'll go burn my damn bra now. Let's just go do that. Because no one's listening. Maybe that'll get them to listen.
He's actually, he's very much at that point. He is.
Yes, Katie. Yes.
And Misha, and I want to let you know and offer to you or even to other people. I've been trying to help different people for a long time that have autoimmune illnesses, and well, most of them have autoimmune illnesses, but other things. But I've been like on the phone an advocate for people. If you are ever having a hard time and are feeling alone and feel like you need a friend there with you, and this is something I always say, I'm always right in your pocket, and so are a lot of other people are right in our pockets.
That's the village right there, and that's what I have wanted for so long.
Yes.
But I didn't realize that you
use
actually
it.
had been an advocate. My biggest goal for this week was to get an advocate.
Well, now you got
Wow.
two, so look.
And I don't
I
think
appreciate
either
that.
of us pull many punches. We've
Nope,
both
not at
worked
all.
with doctors. We don't.
We're
We're not
both sick of the
afraid.
bull crap.
Yes.
See, I used to be that way. I am an advocate for other people, and usually for Bradley, but with the insurance thing and the SSI and just completely being ignored to the point. I mean, Bradley had a doctor's appointment with SSI, and it was their doctor, and we showed
Yes.
up and the lights were off in the office. There was
Well,
one
that's
light underneath the furniture that's built in
Hey,
the
Skylar.
wall unit. There was one light
yes.
underneath there for the secretary, and she is the only person. She was a CNA or something. She is the only person we
Kind
saw
of
in that
makes
entire office.
makes you think about those old days and things that you used to hear back, way back when about. I mean, I'm not saying this is happening this is not my opinion, or it might be my opinion, and it's allegedly, and it probably hasn't
It's a
happened. And
thought.
whatever the
Nothing
hell
here
I'm
is to be
supposed to
considered
say,
medical
let's
advice.
just say it like this. You know what? It's kind of those little fold up shops. Let's go fold up a Social Security denial place and fail everybody that comes through here, and then leave.
Yeah. But that's what
That's
they
kind
do
of what
It's
it
too.
time
was,
for
I
that shit
think.
to stop.
And that was an SSI doctor that they'd sent us
Thank you,
to.
Mina.
And he ended
Yeah,
up
of
signing off
course.
on Bradley.
Of course.
And, in his paperwork, it shows 400 pounds is what he weighs. He's never weighed over 200 ever a day in his
Oh, my
life.
camera's not working.
Oh, so they just make up and fill in
They
and
made it up, filled it in.
pretend like they were
Great.
there and did their job.
And
that's
what it
something.
is there's a mess up on his paperwork because he went to the Shawnee Hospital and they were in the process of being taken over by St. Anthony's. So it is called St. Anthony's, but in St. Anthony's, the main one that we're all used to in Oklahoma is in the city. They called there and there was no record of him. And so it looked like he was lying. It wasn't that. They just didn't have all of their information to where that it worked together.
Right.
Right.
Like
And so when
maybe
they
it's
pulled him
St.
up, it didn't show up.
Anthony's.
But you know how to get that information now, right? I mean,
I've got
yeah,
thousands, literally, not even just
Yeah.
over exaggerating. I have thousands of papers
yeah.
for him. And I've got all the CYA. I've got everything. I've always been big on that.
And you'll need it. They don't make it easy. They make it very difficult.
Yeah.
And
They just don't listen.
it's very
they don't.
frustrating. No, and if they can really not listen, that's even more to their benefit. It
And
just
because
is, it makes
we're
it
on the
very,
lower spectrum of that ladder, they
Well-
really aren't. And he would go in because, I've got they I don't know if I should show this or not, but it's whenever he was struggling with his eye because it was so bad that his tumor was on the outside of his eye.
Oh,
And it was a doctor where they were studying hospital. And they had like 20 doctors come fill in looking at his eye because they'd never seen cancer on the outside of a body like that before.
Oh, no.
And yet he was in remission. Nobody told him. They just sent him home with the mask. Nobody would tell him anything. And he's a biker. He doesn't ask things like that. That's what I was there for. And whenever he definitely couldn't advocate for himself, he went to a doctor's visit once and they had changed policy to where that the copay was like $40. And they didn't tell us and we didn't have it. And we're like an hour away from home and he was in the Medicaid card. And so he wasn't even in his own vehicle. And he went in there and the nurse loudly said, "You don't even have $40.
What?
See, all those things.
Yeah.
All those things. Can I tell a little story? And I'll try to make it quick.
Absolutely.
The other day, the pharmacy sent me a message saying that they couldn't refill my medicine because they were out of it. Right? So I called and it would be 4 days that I would be out of my medicine until they got it in. And so he said, "Okay, so you'll have it on Wednesday, all right?" No, not all right. You're just assuming I'm okay to be 4 days without my medicine.
This is not okay.
And I said, "Isn't that sad?" And he said, "Not really."
Oh.
He
Oh.
said, "Because I can give you a partial fill." And I said, "Well, I know that you can give me a partial fill. I know that, right? Because I can call and say, could you give me 4 pills?" But I had to do this whole argument of like, do you not get that it's a problem? That you're just expecting people to go 4 days. That's a
Okay.
seizure.
Yeah.
Mhm.
That's an infection. That's all kinds of things. And you are just writing me off again. And so we really do. And Misha, it's good. And we can work together for sure. But it is good
Yeah.
to always be ready to advocate for yourself.
Yeah. Yeah, because it's coming back on him now, and they wouldn't listen to him. So he doesn't even go to the doctor. He won't even go because, he has lost his entire faith in the entire facility because, he had a spot come up on his back and the doctor literally just said it was a mesople. Wouldn't even look at it. I've got pictures of it. It's the size of a goose egg.
Okay, so there's a thing called the Hippocratic Oath.
Mm-hmm.
And there's a few things that they're not allowed to do.
Mhm.
They're not allowed to lie to you so that they don't have to treat you. They are not allowed to do that. So,
It is their responsibility to treat you whether you can pay or not.
or not.
And so what they do is they treat you very badly. And so that way you refuse to go back because you don't want to be treated that way. And that's what's happening with a lot of people these days because they're so scared. They are treated, we don't know the jargon that doctors do. And so when they speak certain things and you ask them what they're saying in layman's terms, they just look at you like the entire thing. It's so disheartening. And, when you're already dealing with the health issues as it is, and then you're
Yeah.
dealing with your pride, and then you've got like Bradley, he couldn't work like he did anymore. So he is stressing about how to take care of the family, and nobody wants to listen. It's ruining society because those that can get medical treatment, they're just being given prescriptions and then handed off. And, once upon a time, I got all kinds of my diagnoses, but as far as getting any now, I get handed a piece of paper telling me what I have, and then the therapist running away.
You were not working through things.
Yeah. I'm not really in the best of minds right now to be talking
No,
about
okay, so I'm
things,
going to
but
tell y'all the first thing that is okay, so you have men and women. So let's go to the women. What is the first thing that we are told? We're hysterical.
Yep.
Mhm.
You know, we're we're mental. We're hysterical. It's just got something wrong with her all the time. And it is a very, very real thing of the gender biases for sure. I mean, like literally, you will be set. Women will be set to have to stay out in the waiting room longer than a man. A man and be seen for the same symptoms, but they're not hysterical. We are. Um, it it's saying, and this is how is gender bias linked to gaslighting? And gender bias is a significant factor contributing to medical gaslighting because with women being more likely to experience it due to the bias and social inequality. Exactly what we were saying earlier. And women's concerns are more likely to be downplayed. They just don't get listened to at all. Misdiagnosed, get misdiagnosed. Let's see, because our symptoms are not as serious or psychological. You can be pushy, hysterical, female patients saying anxious, and then gender bias can lead to unequal treatment with women potentially waiting longer than men to be seen for the same symptoms and to be treated. So with men, it's back pain, they're drug seeking. I mean, working in the ER, I'm just telling y'all right now, the first thing you go in with back pain, you're drug seeking. It,
Yeah.
Number 2, you go in with nerve pain, fibromyalgia, any of the shit that I've been living with for the last 15 years, and I know everybody else has too. Any kind of nerve pain, anything that they can't see physically broke, then we're crazy and we're drug seeking.
Mm-hmm.
Okay, so there's your two, so
Drug
it's back
seeking
pain for
both times.
men.
Mm-hmm.
Yeah, it's back pain for men, even though you probably have, I mean, you 100% had something wrong with you, they would still gonna just overlook you. Why do you think I would not go to the hospital this last time with my feet swelling up and busting open just like they did and just like they're starting to do again? It's because I refuse to go to a hospital and I refuse to do it. And the reason I refuse to do it is I'm advocating for myself. If I can be treated at home with the same damn thing they're going to treat me at the hospital with, I can get up and move around and do my own thing at home, right?
Right.
The way I
Yes.
feel
You're
it.
comfortable. Yeah. And I feel you
And it's my
100%.
choice. I don't want to be put in a damn hospital. So I get hospital acquired diseases,
Yep.
viruses, bacteria. I don't need to go through that again. Not right now on immunosuppressants. So I guess people that say they love me and are part of my blood family out there, just in case they might be listening. I doubt it, but just in case. I don't want to go to the hospital for a reason. The last time I did, I got pneumonia just for getting an MRI. Okay.
It's true. It is true. And I'm with you at a certain point in your illnesses, the backs, the fibros, the different whatever you personally are going through. You do almost, you try to learn to self-manage, right? You really do.
Yeah.
And so when we don't feel well and knowing what we've gotten a lot of times, like you said, we've gotten a lot of times, it just feels like, man, that's going to take an awful lot of energy for nothing.
Yes. That's so it.
You know, and I hate to say that, truthfully. I hate that it feels like that, but it really is like,
it's so draining. It's so draining going down the rabbit holes of calling this person and then being sent to that person and being sent to that person.
Somebody marked Olive. I'm sorry. I was just looking on Pope Groomers. I couldn't find her number 1.
Sorry, y'all. Brutus is like right next to me snoring it.
Oh, they're fine.
That's
They're
cute.
fine. I was trying to find Pope's first one, but I don't see where it's at. I missed it. Unless it's already started. That would be my fault. Because I'm over here touching this.
I'm not even looking at comments. I can't hardly see anyways right now. So
well, I was gonna read some out, but I was just looking for Pope Groomers. Those I don't even know. I can't see hardly at all. But I did want to new comments. There's part 3.
I don't see the first one.
There's I didn't see the first one either. That's why Pope Grimmer, I can't see part 2. I mean part 1. So I was looking for. Dang. Okay, so I don't know where it went. Okay, so let me ask this. I want to know the difference if anybody's willing to come on, and if you don't want to come on, you don't have to. Mexico and Canada.
Oh yeah, I'd love to hear that.
Mm-hmm. Mexico and Canada. And y'all don't have to come on if you don't want. If you just want to answer in the comments, it's fine too. I was gonna ask each of you, like whoever come on with for Mexico and then for Canada, to see the differences in all 3 of the medical systems. Oh, Sophia. Ouch. See, carry on. You right? I mean, okay. So I was just wondering. Okay, so look, I got a Canadian. Oh, y'all right there. It's Spanish. Okay, so my question is, okay, so y'all always hear how bad this healthcare system sucks. In the United States, especially our mental health care system, which Texas is last. So, what is the difference in, let's say, gosh, how can I do this? I'm trying to say it without mixing myself up too. Social. I don't know if y'all it's called socialized medicine in Canada or what it's called, but I know I have a friend that lives in Canada, and she's always telling me about, she has to wait so many months before she can get into an appointment, but it doesn't cost her what it is to get into an appointment like it would be here. And then how are they in Mexico? Do you just the difference in I guess our medicine? I don't know what I'm trying to say. Somebody help. I'm drowning.
Let's see what did Carry On say. She said in Canada, doctors do not have to talk to insurance companies. They just do medicine. The biggest problem is that there are not enough doctors.
If they didn't have to mess with insurance, medical
just
schools
do
need to
the
let more
medicine.
doctors into med school. I would say, yeah.
Yeah.
You want, wait, I mean, okay, you have Social Security, 2 different institutions paid by the government, and they both suck. There you go. If you want good attention, you have to have private. And it's insanely hard to get into medical school. They just order the test and it's covered by the provincial health. See, okay, there it is. Okay, it's very hard to get appointments, and you don't have medicines. I mean, okay, there's the difference I was looking at. So do you see, Tiff? That's what. Look at the
they have
difference
to pay.
between. I mean, it's just like it's actually like a trickle down effect. It sucks like bam, bam, bam.
Yep.
So Jimena's like, I just wish things weren't like that. Universal medicine, but the U.S. takes all our good doctors because it is
for profit.
For profit.
They're gonna make the money.
Wait times for surgeries can be longer sometimes. That's what I heard. It took her 6 months to get an appointment with somebody up in Canada, but she said once she was in, I mean, all her stuff got done, but it was a long time, and it's not really something. I don't know what I guess let me ask about like for emergencies and stuff like that.
I'm gonna hop off for a minute. So,
okay, did you have that stuff ready?
Well, I can't find. All I've had was just a dysregulation. Is all I had. I didn't have the other.
Oh no, I'm sorry. I'm sorry. I thought you were gonna.
I would do it if I had it.
Well, I'm actually running it back through how I made it last night, but
do you want to send them to me, and then I can run it through and then come back when it's done and we can do it?
Sure.
Okay.
Let's see. I get amazing health care in Alberta. They studied for pennies and then they go make money. That's true, huh? Yes, I think it's still under the same thing. What I do, just hit share. I mean, I've already.
Yep.
Hang on. Why does it pull my brother up? Oh my god! Add people. I'm trying to add. I don't even know how to get this back to you.
You should be able to just click the share button and then copy the link and send it to me on the chat here, and then I should be able to grab it. I mean, I wouldn't be able to get like what you have. Like last night, you know how you got the one from me, and you weren't able to do the interactive chat with it. It'll be the same way, but I should be able to pull. It says I don't have access.
I don't know what to do.
I have a question for the Canadian.
Please save me for a minute.
Carry on. Do you get to choose your doctor, or do you just call and say, I need a doctor appointment, and you get who you get? Or do you have somebody that you like see regularly and follow up with regularly? I'm curious, since you have the shortage of more crap doctors in Canada than good, in my opinion. Took a year to diagnose my son with Crohn's. Oh, he was in failure to thrive. 3, good golly. And had a fungal infection, they said. Oh, they said they were trying to just say he had a fungal infection, not Crohn's. Yikes. You can shop for everything, but not your doctor. When you have one, you say thank you. Yeah, that's what I kind of thought. So even if you're looking for a specialist, say a GI doctor for Crohn's, right? Do you just get someone different each appointment? Barbie says she has a family doctor. If I need a specialist, then my family doctor has to refer me such as a kidney or pain specialist.
It won't let me. It's got to add. It's telling me to add you. Sorry. Just add people. People have access to me.
Carry on, you are very lucky. She said she's had the same doctor for 26 years.
I've not ever gotten that lucky.
Pup says, Keela sent my comments via email since the first one wasn't showing up.
Who is that from?
Pup Groomer.
Oh, okay. Okay, thank you,
Yeah.
Pup, because I'm going to pull that back out. Yeah, thank you. I'm just trying to get... Okay, this is going to back up because I don't know what in the hell is going on here.
You have to be referred to.
Nothing is working on my, I don't know what's going on. I'm just going to quit touching anything. There it goes.
Okay.
I just deleted everything I didn't need to delete. Help me, please. Just help me. I just need to add this freaking... There. Nope.
Okay, so you have a family doctor and a pain specialist. Now, once you've established that, once you get your I have all these questions, Keela. I'm sorry.
No, it's not you. It's not you. I'm looking. You go ahead. I'm looking at trying to get Michelle. I don't know what the hell is going on. Copy link. It won't give me a link because it's saying add people. Full notebook. I don't know what to do.
Click the address that I put in there. In the Gmail.
Okay, so I'm going to copy link address, right?
Mm-hmm.
It's putting StreamYard on there.
Is it doing StreamYard?
Yes, it's taking it to StreamYard, then semicolon, then you.
Wow, carry on.
And I can't back up. It won't let me backspace. Oh, wait, now. Nope, stop. Something is weird. Okay, it's going a little bit of time.
Oh.
Good.
So Barbie,
y'all, if
once
we get
you
this together, I'm gonna
establish
be
your
so
doctor,
happy. Like y'all don't even know how happy I'm gonna be. Send the link. I hope I just sent it to and made it the right thing.
Is it easy to get into them? After that first time?
No, I'm redoing. Maybe.
I think we got it.
I had to send the editor back over there. Make sure you get that, please.
Okay, I think we're good.
Karen says my husband is a radiologist. Is so insanely busy with the number of tests being done. He works 12-hour days. No break for coffee or lunch. I can relate to that.
Okay. Okay, guys, I know y'all got a lot of questions. I'm sorry. Thank you for giving me the time and the grace to fix this. I appreciate it because there's some great information on here, and I had it all in slides and everything. And never mind.
Okay, now
Red. Okay, Red's back. Red's saving my butt. It's not Ned.
Yeah, it's showing up. It's just not. Let me see if it'll show the sources.
I sent you another one for. No, it's like gone. I've just been going to the bottom and clicking on that.
Okay, I'm just going to share screen.
Okay.
Thank you, Carrie.
And then
so you do still go to the. Okay.
Can you guys hear that?
Mm-mm.
No.
No?
Ah.
Why can't you hear it?
We have to add it to the stage.
Because you got to add it to. Oh my lord! I can't add it because I'm not in the same
Add
StreamYard.
the stage. There you
That's
Thank
funny.
you, ladies.
Okay,
go.
Nice and
Really?
Yeah,
happy.
that's kind of a
now can you
scary
hear
thought,
that?
to be honest.
Can you hear that?
Yes.
Okay, so
There-
this is what I worked on last night, but this, it is what it is.
You
Wow.
walk into a doctor's office, with a real problem, and they just brush you off.
Oh, I totally get it.
Like they just don't believe you and your symptoms are real.
Yeah.
That's medical gaslighting. And it's a serious problem because it can mean,
What?
misdiagnosis,
Right.
treatment delays, and sometimes even, really bad health outcomes.
Yeah, it's not just about feeling ignored or something. It can actually,
Right.
affect your health.
For sure. And we actually have some really interesting sources
Oh, cool.
dive into this whole issue of medical gaslighting.
Mhm.
And more importantly,
Okay.
they offer ways that you can advocate for yourself or even help others
Hmm.
who are in similar situations.
That's great.
One of the examples that really hit me was this story about a woman who had like constant chest pains.
Hmm.
And the doctors kept telling her it was stress and anxiety,
Oh, wow.
even though she had a family history of heart disease.
Oh, no.
It took her months to finally get a diagnosis and the right treatment for a serious heart condition.
That's terrifying.
It really shows how dangerous this gaslighting can be.
Mm-hmm.
The delayed diagnosis, the suffering, and the chance of things getting worse.
Exactly. And, it doesn't just happen with heart conditions.
Right.
We're seeing this with a lot of other health problems, too.
Yeah, like what?
Well, for example, there are cases of ovarian cysts that are misdiagnosed as just normal period pain.
Oh, this is the worst.
Right. And then there's the way some doctors talk to their patients using language that's super dismissive. Yeah. Yeah. Like what kinds of things? Oh, calling them anxious or pushy.
So hysterical.
Yeah. That one's especially bad.
So we see the problem and how serious it is.
Totally.
But why does this even happen?
Right. What are the root causes here?
What's going on?
Well, our sources point to a few key factors.
Okay.
And often it's like a combination of them all working together. But one major issue is gender bias. Those societal inequalities that unfortunately find their way into healthcare.
It's almost like there's this assumption that women are exaggerating or that their pain is somehow less real.
Yeah, and while gender bias is a big part of the problem, it's not the only thing.
Right.
Sometimes it comes down to the doctor just not knowing enough.
Okay.
And this isn't always about being malicious. It can be a lack of awareness about certain conditions,
Oh, okay.
especially the ones that affect women more often.
Interesting.
You also have to consider biases that exist towards certain groups of patients based on their age, their race, or even their economic background.
That makes sense. But what about the doctors themselves?
Oh, you mean like their attitude?
Yeah, like could be arrogance?
Oh, absolutely.
Really?
Yeah, some doctors are just overconfident
Sorry,
in
I
what
was
they
a little
know,
Uh-huh.
and that
smarty.
can actually prevent them from really listening to their patients.
Wow. So they might not even consider other possible diagnoses.
Exact.
So we've talked about the problem and some reasons why it happens, but what can our listeners do
Yeah.
if they find themselves in a situation that feels like medical gaslighting?
Well, the key is to feel empowered to advocate for yourself.
Okay. Love that. How do we do that?
Advocate
One of the
for
first
yourself.
things is recognizing the signs, like dismissive language. A
Right.
doctor not wanting to order tests
Yeah.
or blaming your symptoms on mental health without actually checking it out.
Okay. Those are all red flags.
Exactly. And once you know the signs, you're better prepared to handle the situation.
So what are some practical tips for actually advocating for ourselves?
Well, our sources suggest a few really helpful things.
Great. Like what?
First, bringing a friend or family member along for support can make a big difference.
Oh, that's a good idea.
It's good to have someone there to listen and validate what you're going through.
Yeah, for sure.
Another key thing is to document your symptoms really carefully.
Yeah.
Keep a detailed record of when they happen, how bad they are, and any other relevant info.
Makes sense.
And remember, you always have the right to get a second opinion.
Yes, absolutely.
Don't hesitate to do that if you feel dismissed or like you're not being heard.
Getting a second opinion isn't about questioning your doctor's knowledge.
Right.
It's about getting a different perspective and making sure you feel understood.
It's about feeling confident in the decisions you're making about your healthcare.
Exactly. And you know what else I found really interesting in our research?
What?
One source mentioned that women often have to wait longer than men.
Really?
Yeah, even if they have the same symptoms.
Wow.
It's crazy, right?
It just shows how deep this bias runs in our healthcare systems.
Yeah.
It's a systemic problem, and we need to change things on a larger scale.
Definitely. So, to sum it all up, the main message for our listeners is this:
What?
you know your body better than anyone else.
Right.
Trust your instincts and don't be afraid to speak up for yourself.
Advocate for your health.
Exactly. Because your well being is the most important thing.
And advocating for yourself can also help other people who might be going through the same thing.
So true. Now, here's a thought to leave you with.
Okay.
How can we as a society push for a healthcare system that's truly equitable and attentive to every patient?
That's a good one.
It needs to value each person's concerns and experiences.
Yeah,
It's a complex issue,
for sure.
but it's a conversation we need to have.
I agree.
Keep thinking about it, share your thoughts, and let's work together to create a better future for everyone.
Absolutely.
Whoa, did someone just break the fourth wall? Let's hear it.
So
What
once you
was that?
have all the documentation, once you have your proof and all of your
Mhm.
notes, where do you go from there?
You keep going until
Well, that's a
somebody hears
fantastic
you.
question, and it's so important.
Yeah, it's one thing to gather all your evidence, but what do you do with it?
Okay, so you've got your notes, you've tracked your symptoms, you've brought someone for support.
Right, and you're ready to make sure you're heard.
So the first step is to go to your doctor, armed with all this information.
Don't be afraid to present your notes and state your case clearly.
Use factual language and stick to what you've experienced, just the facts.
And if you feel like your doctor isn't taking you seriously even after that,
Well, then it's time to consider getting a second opinion, which we mentioned before.
remember, you have a right to seek another perspective and make sure you feel heard.
Exactly. And it isn't about questioning the first doctor's knowledge, it's about getting the care you need.
You know, in the sources we looked at, there's some advice about advocating for yourself.
Right? Like, what was it?
It says to bring a loved one to witness your interaction with your healthcare provider.
Oh, yeah, that's key because it can help validate what you're experiencing.
And keeping those detailed notes of your symptoms to present to the doctor really helps.
So, after all of that, if you're still facing a brick wall, it might be time to think about switching providers.
Yeah, that's a hard decision, but sometimes it's necessary to find someone who truly listens.
So, basically, even after all that hard work and documentation, you're still advocating for yourself.
It's about using that documentation and information to feel confident in the decisions about your health.
Which is so important.
Absolutely.
Well, that about wraps things up for today.
Yeah, we've covered a lot about medical gaslighting and how to advocate for yourself.
So, until next time.
Bye.
I had to
Don't
throw
you
a
love it?
question in there.
That was good. I loved it. I loved it.
Yeah, it was right on.
Yeah,
Hey, I'm loving all these new programs. Sorry.
I'm telling
It
you,
really
there's
is.
so much out there. It's
And there's
putting it to
there's
use.
so much that sometimes I'm like, okay, can we do away with WebMD, please?
Right.
I'm not a fan, and I truthfully I always discourage people from looking up their symptoms or their.
Mm-hmm.
I'm like, just don't look. It starts at A and it ends at it's over. I mean, that's everything. A stub toe will end at it's over.
Mm-hmm.
It's just where it goes because it can potentially go there. So that's
Right.
so it's like I hate for people to look at WebMD. I think it can be informative, but I think it can also be terrifying when you don't need to feel that way.
Right.
No, you don't. And I don't. I hope no one feels that way. Like I did. So, and I didn't want. I don't want to have to say this about me, but I just really quick. I'll say, okay. So from June of last year, of 2024, until today, and everybody knows how crappy I mean, my whole damn face has changed. Everything about my whole appearance, it's just gone. It's fine. There's nothing I can do about it. But June to now, this is what, February. So there have been a lot of things that could have been fixed and been caught if I wasn't going through the same things. So I've had my same doctors. They treat my mental and physical, and they want. I know they're not my neurosurgeons or anything like that, but I mean, they can do the mental, the physical. They can order any kind of test that can be brought to your house, like X-ray, ultrasound, echo, all that. I don't have to leave to go get that done. Labs. That's why I love the service, that I use.
Yeah.
Here's the thing, though. Because there was a little rift in that very thin level of patient care, and then me being a facility owner that you come to my facility to work to get patients in. Is maybe there was some things that was not done right on both sides. I mean, and so my treatment got delayed. Like everything I had, they let my physical therapy run out. They let everything run out. My insurance ran out. I mean, everything in 1 month, and I'm going crazy. And the 1 month that I asked them, do not come because I'm not covered on insurance for some reason from June 1st till June 30th. But after that, I will be back on my same insurance. It was a mistake. It happened at United Healthcare, supposedly. Well, that 1 month I had chest x-rays. They come out to finally visit. They put me back on home health for my physical therapy in-house. And I'm like, oh shit, the 1 month I didn't have insurance. So yeah, I know exactly how it feels. All my meds I had to pay for, and I put off the ones that I could put off until my insurance kicked back up. But I don't go. They know that I fight. My mom's an RN, and she's a mean RN.
Yeah.
But she will make me go. Like I hate hospitals, and I don't want to be a patient in one. And now having to go back with all of this new stuff, and him say right up the front, if you would have, come in a little earlier and then I have to hear, I told you so. I told you so. You should have said something. No, actually is I did just what I wanted to do. I didn't want to be stuck in a freaking hospital or be thought I was crazy because you're not finding anything on all these tests that you've done that has anything to do with the pain I'm having. So no, I don't want to, and I can't even take pain medicine anyway. I'm over here fighting doctors for steroids. Come on.
I know that feeling, and that it's pretty sad when you're like, come on, give me good stuff. Give me the big one.
I've already got to live with this crap. You might as well give me the stuff that's going to knock the pain out.
I know. And you're right. It does transform your face, your neck. I was on my own live stream the other night, and I was like,
I'm like,
look at my
whole family's
giblet.
saying the same thing about my face being so round, but
you were there.
I got to live with this, so you're gonna have to do something.
Yeah, it's just, but I would rather take the time out to try to feel better, and that's what you're doing right now, Keela. Is kind of trying to take the time out for you to try to work on feeling.
I did get a cardiology appointment. I'm waiting on the rheumatologist and the endocrine. I didn't know they had referred me to an endocrine specialist.
Oh, well, it's good.
Yeah.
Probably because I'm going to kill my adrenal gland with all these steroids anyway.
Well, and a lot of people are just sick because of all the medicine that they've got, the different combinations of medicines going here to fix this. And then you got to take this medicine to fix that and to counteract that.
Yeah, let's take let's go from 10 milligrams of a diuretic to 100 milligrams a day. And nobody put me on potassium.
Did you wake up like a beef jerky?
I've walked around for 2 weeks screaming to the top of my lungs for 2 weeks straight. Now, before last week, I was screaming to the top of my lungs how bad my cramps were, but you can't move it because
I know
it's so swollen and got fluid coming out of everywhere, so it's like, oh my gosh, I drank every pickle juice, I ate every pickle, all the salt, anything I could find. If it had calcium or potassium or sodium, I was grabbing it. My stomach was not loving me right then. But when my doctor got back to finally seeing me, my nurse practitioner, the one that, should have been there but things happened. Okay. She was like, Keela, you're on 100 milligrams of this torosumide and you're not on any kind of potassium. I said, nope. Well, you understand, this is why everybody's calling my house, but I called her first. But everybody was calling my house trying to wake me up. I was asleep. Yeah, because my potassium went to 2.1. Critical level.
Yeah.
She had me take like 40 milligrams right there, and then
to bring you back up real quick.
Yeah, it's still, my last level was still critical. It was 3.1. They're coming back tomorrow to do it again. She's got me on 40 milligrams a day, though, so or milli equivalents, whatever it is. Yeah. I take 40 a day, and I didn't take any, but my cramps are easing up.
Good.
But she asked me why I didn't say anything. I was like, okay, so you know what? I've told every single person in my whole medical health care and my family and my home health and my therapist and everybody that could possibly freaking know that I'm having cramps so bad every night I can't sleep. I walk around my house. What did you need? Did y'all need to see that critical level on a freaking lab report?
Sometimes
Because that's what made everybody wake up to see that I'm not over here freaking lying.
And that's another thing that's crap about the gaslighting is that that's what it takes for you to believe that there's problem. Not saying that was the case in your case. I'm just saying sometimes that can be the case.
It's like, what is it, Katie? If I go back to my doctor, it will be to get the MAID program. It's like, what is that, Katie?
The MA.
Yeah, I don't know what that is. It's so crazy, even like the differences in everybody.
It really is.
Wow. I'm just reading some of this stuff like Eric, you're right. Yeah, because Medicare now has Part C. So we can get dental and vision, yes. And they just killed our United Healthcare just killed our OTC cards. Oh my God, Katie. Really? What does that mean? Okay, I'm so confused. That is really weird. Like I don't know I don't know what all that means.
What, Katie's?
Yes, it's freaking me out a little bit.
Well, there are the state. If this is what she's talking about, there are states that's legal, and somebody just did it recently. She had a little story on, and so I'm not sure if that's what she's talking about. And then if would it be covered by insurance?
I don't think in
The
the
medically
States.
assisted.
I don't think in the United States it's not legal. Okay, Pub Grimmer, is that your first one? Is that because I can't get into my messenger on here. I gotta fix something on this computer. Okay, I want to go to the start real quick. See, it's covered by your health plan. Okay, wait. Just please, somebody tell me something. I think I'm losing it. You're here to tell me that killing yourself or assist or whatever it is covered by your health care plan in Canada? Somebody please make this make sense. For real. I'm just wondering because
is that what it's called? MAID? What?
I'm freaking out because you can't get health care in this country. If you can't get health care, why are they quicker to just give it to you, give you that? Like, I mean, oh my God, I think that just knocked me.
Yeah, it makes your mind go places it really shouldn't.
Yeah, that really did.
I know.
Really got me. I'm like, I'm thinking, so, but yeah, carry on. I'm just saying, I'm like, what in the hell? You can't get, we're having hard enough time to get, I got it. Yes. Okay, I got part one. All right.
Yeah.
Guys, I am going to hop off though.
Okay, well, thank you for being here. I'm going to go into the comments and all that and do that.
Yeah.
Okay.
So we could go, but this is a very important conversation I wanted to have. So, and I'm so glad that all of you were here to help. I appreciate you.
I wish I could have done more.
Thank you for having me.
And Tiff, I'm going to be getting a hold of you.
Yeah, honey, hit me up.
So. All right, guys. Love y'all.
Love you guys.
Love you.
Thank you.
Okay.
Bye-bye.
All right. So here you're going to help me, Tiff, with some questions. Let's see. Okay. Brazzy, I just know with her consent, she's been transferred to a different hospital to address her kidney failure. Oh, good. Thank you, Jesus. Good. Let me talk about my girl. Evaluation. Yeah.
Glad.
Today's impressed for her. And Heather says it's only like that in the U.S. Do we know if it's like that? Oh, well, we got into it. We got into that one.
We did.
Yes, we did. It's a global thing. Let's see, Katie. It's a doctor. It's a doctor mental and bedside manner that is the problem. They're too narcissistic. I agree with you on that, but guess what? I'd rather my doctor be narcissistic, and I hate to say that. When I was doing the research, I have researched this. Like, I've really been going through it, and I had all this stuff. I've already come to the determination. I'm just going to leave this caveat here. It's better for me just to stop trying to plan it and just go with it and go, because I try to get it all perfect and it never happens. And so I'm going to stop trying to make that expectation of myself, because obviously I cannot achieve it. So anyway,
Yeah.
it goes where it goes, whether my
Yeah,
stuff
well,
works or
and I
not.
think everybody is good and comfortable with that. This has become such a nice, comfortable space that I think everybody's pretty comfortable and
Good. Thank you. I
giving.
'cause
We're
I
giving.
want to make sure everybody's heard too, and that's my main reason for being here. But I just don't know.
There's just
So
no way to make it go perfect.
no. So instead of me playing a little video for you that I made on one of my AI programs that I'm really willing to, I'm kind of learning into this stuff now.
It's fun to play with it.
Yeah, and if it comes out good, that's great. I'll throw it up as a short or something. But this one did actually come out good, and it was about the doctor being the narcissist. What would you rather your doctor be? A little. I don't even know what words. So I don't want to use any disparaging words, but one, little submissive doctor, or a narcissist doctor that knows that they are the best surgeon in the world, and that's it. That's the
Well,
one I'm going to go pick, because
yes.
he's going to prove it. Or
Yes.
she's going to prove it. I guess that's what I'm trying to say.
And a lot of times, and I hate to say this, but a lot of times, some of the best doctors really don't have the best side manner.
No, they don't.
They
And I
don't.
can't stand that. I can't. And I'm sorry. I don't like that.
I don't like it either.
I
But it
don't like
just,
it. But if they're taking care of me, so be it. But if you're going to come in with the bedside manner, I don't remember staying in the hospital after I had my C-spine surgery, but I do remember a little bit of my memories are coming. They use that propofol to put me to sleep, so I already don't have any memory.
yeah.
But I do kind of remember the doctor coming in there and when he told me I could go home and I could eat, and he told me that he wanted me to walk around the nurse's station, and they took my IVs and stuff out and let me so I could actually walk, and I was doing good. He said my neck was holding up. It was doing great. So I got to go home. I was like, thank you. But he had the same bedside manner as he did in the operating room as he does at his office. He's amazing.
Yeah, I like
He
that.
never gets all upset. Everything's just laid back. And
Yeah.
he never upsets you, even when he tells you, it's because you got a 50-year-old spine, honey. And I'm like,
Yeah.
I think I want to knock you in the face.
I know. Like, excuse me, what did you just say?
That's what
My
he said.
spine can't be 50.
That's what he said. It's so free. I always wondered why medication didn't do much for me. I weigh more than the average male, and I'm a redhead. So the female dosage, no, you're a redhead. It's not going to work for you. The same
Yeah.
dosage, sweetheart. And I'm not saying anything else. Don't start doing that about your weight. I love you. You're beautiful. Crystal, they misdiagnosed my sister for over a year until her ex-husband, who is an MD, set them straight and threatened them, even told them exactly what was wrong. And finally, she got the proper treatment. That is the whole deal. They don't listen. They don't listen. I have no feeling in my feet from nerve damage, and yet it burns. And they say, will.
See?
That's what it does. Yes, absolutely. Living by
That
this life,
is nerve
absolutely.
pain.
And it is nerve pain. I mean, that's what it is. Tomas, my first MS attack, they wanted to send me to a psychiatrist. Yes, isn't that funny? And people with you know how else they go after? People with sickle cell anemia. They call them drug seekers. And that is the most painful thing ever.
Yeah.
Eric, that's how my body and my legs and my back have been hurting since April of last year. I went to see my doctor. She told me to exercise your muscles from home if it didn't work. I'm 37 and feel like I made it. Yeah. Okay. So that's, to me, right there. Get a second opinion. Go to somebody else. Don't stop.
Yeah, don't.
Sophia, doctors studied it, but the patient lived in that body all her life. I don't know what that means. Carry on. I feel so badly for U.S. citizens dealing with healthcare in the U.S. It's a very messed up system. It's a very screwed up system. Thank you, Carry On. It is so screwed up over here that I have to sit and watch people. Like they took that, they literally, my insurance that I've been with forever with United Healthcare, they have taken so many medicines off the freaking formulary. And I'm like, how can you do that? That's all I can take. And then you're telling me it's going to be $800. It's not covered and there's not another brand. What the hell are you going to do? I'm really freaking out about this right now.
I know. And then also, like, the doctors are not as, I'm like, let's do a prior auth on it. You know, try to do a prior auth on it.
Which I
then.
think are a bunch of bullshit, because if the doctor didn't want you to have it and hadn't tried something else, the
Right.
insurance is not to tell the damn doctor what to prescribe. That's
Right.
what pisses me off.
I'm with you there.
I'm like, prior authorizations are crap. Like, it's really screwed up. I mean, if the doctor did not try something else and think you didn't need it, they would not be prescribing it. Who are you, an insurance company, to question a doctor's prescription? They sure the hell do every single day.
Oh, yeah, they do.
So, every day. All right, Desert Texas, let's talk about how hard it is to get mental health treatment sometime and come up with a fix for it. Yeah. All I can just say, Texas is 50 out of 50 states. It's not working.
Yeah.
I paid years in the Blue Cross when I needed them. They wanted blood. They wear you down until you just give up. There you go. And that's why I wanted to bring that up. They expect you to give up. They expect you to stop. They expect you to be the one that walks away. They expect it. Don't stop. Y'all, as tired as you are, get your advocate in there doing it for you. Get an advocate. Get your advocate in there doing it for you. Don't stop. If you stop and you give up, that's what they want.
Yes.
And you're exactly right. That's what they're banking on.
Yes.
If y'all ever have a question, go watch the movie. Go watch the movie. Then I know I'm not gonna be able to spit it out because that would be just too easy for me. I'm gonna sit here. I'm gonna sit here until I can say the word that should be coming out of my mouth. Brain, please. John Grisham. Kilos. Gone.
Is it a John Grisham movie?
Danny DeVito. John Grisham. It's John Grisham. It's Danny DeVito and who else is in there? He plays the what's his name? What's his name? Okay, I'm gonna have to Google this. They fought the big insurance company. Come on, y'all. This is my favorite author. This is how bad my head is. So this is what you get to look forward to if you've got brain injuries or seizures.
Well, look, and then you have Tiffany, who's like,
look at this. I don't even care. It's like, it is what it is. I'm trying to think, what is the one? Where's the rest of his books? I need all of his books because I don't want to have to go in there to my bookshelf. The Rainmaker.
yes.
The Rainmaker. I knew that was what it was. It was on the tip of my tongue. I just knew that was, let's make sure this is the right one. Summary. Yeah. Rainmaker. Watch Rainmaker. That's it. That's it. That's it. That's it. I knew it was. I just want to make sure because I don't trust myself, my brain. The Rainmaker, I'm telling y'all, this is like, it is in his first courtroom thriller since A Time to Kill, which was an excellent book. John Grisham tells the story of a young man barely out of law school who finds himself taking on one of the most powerful, corrupt, and ruthless companies in America and exposing a complex multi-billion-dollar insurance scam. So he's trying to take down Big Pharma and an insurance company by himself and just out of law school. So if you want to know what damages they do, go watch that movie. Oh, yeah. Read the book, watch the movie, whatever you want to do. But that's what happens. You pay up, you pay up, you pay up, and then they won't put up. Eric, me and my family have Kaiser for our hospital to see doctors here in Culver City. Now, I heard that. I mean, I don't know. I've heard Kaiser names out there. See, I'm in Texas, so it's kind of weird for me. Like, I don't know. Sophia, the weirdest experience I had with my insurance was that they wanted to pay for the anesthesia, but not for the local anesthesia for a teeth thing. It's nice if they. Okay, what the hell? Whoa. Okay, first of all, paying for any anesthesia should not even be in these conversations.
Question, right?
Holy crap.
That is really odd. And
That's
that's
just, I don't even know what to say to that.
that's a perfect example of like the crap getting lost in the words,
Good
you know,
God.
in the print.
Katie, I have no more medical hope. They just decided that my pain is because of my mental health. Ugh. And they don't treat crazy or the muscle. They were mad that I was crying at 44. That's bullshit.
Yeah.
Katie. Mm-mm. Nope.
No,
Sorry.
that's not good enough. That's
That's
a
not good
good
enough. And you don't have
okay.
to accept that. And don't accept
No.
that. Eric, we need a physician's desk reference book with that big blue book. Yes, we all remember way back in the day. I got one under my desk, but it's red. Eric, yes, you're right.
Yes.
Patty, it got so bad here. Yeah, I had a doc tell me I wouldn't make it if I had surgery. That this was one visit. I wanted to go on palliative care bad. Yeah. Yeah. They misdiagnosed you. They misdiagnosed you, and that's just bullshit. They didn't do anything for my pain. I can't even have pain meds. I'm just a crazy crybaby who wants attention. It's finished for me. Nope. Only you, my dear, can stand up and make that change and be that change. And don't you ever give up as long as I'm here. Whatever we can help you, Katie, will do. You know that.
It will. You know, one thing, and I hate to even suggest this because we're talking about the gaslighting, right? But something that I have kind of learned because we've talked about a little bit of the narcissistic traits,
Mm-hmm.
or, you know, the one, I'm the doctor, so I'm going to be the one that tells you what you get, right? So sometimes I'm just going to suggest to play their game with them a minute.
Like we do all narcissists when we have to have them in our spaces. You just give them a little bit of fuel to get what you need.
Yes. And I hate to say that.
That's the
but
truth.
It is the truth, guys. Just sometimes you have to
Don't
say,
mess with
okay.
empaths. Empaths know all the secrets. We can give a little bit of fuel to get what we need.
That's right.
Yeah, it just makes me sad right there. Okay. All right, Pup Groomer. I had part 1 out. Let me look. Okay, so part 1 was last time this happened to me, local gyno said my level 4 prolapse was not that bad. Go to a specific YouTube creator Republic for PT and completely ignore the cyst I have. What? Okay, so I have your part 2. So let me go there. And Pup says, 17 days later, I was in big city for second opinion. That doctor was furious and said that if he had his say, I'd be going for surgery ASAP. I ended up having to have a hysterectomy and full internal reconstructive surgery, all because my innards are falling with the right. I mean, that's what happens.
Yeah.
I mean, oh my God, I'm sorry.
And what they wanted to send her for physical therapy?
Oh my God, hang on, let's see. The local, that's the first one.
Okay.
No, I think. I don't know if that was it, but the local guy said I had issues with gaslit me on my test results. Oh, it's all fine. It wasn't you. Oh my God. See, that's not legal, y'all. That is not legal. Oh my God, I'm sorry. Oh wait, we already did okay, part 2. Yeah. They can't keep you from going to a second opinion. Is what I don't understand.
No, but they also will use some bullying techniques, right?
Yes, they will. That's why bring somebody with you. My mom goes, look, my mom will not let me tell anybody that she is a nurse. I'm 50 years old and I will get backhanded when we get in the car. If I even opened my mouth in a new doctor's office or in a hospital and called my mom anything about being a nurse, because she sits back and acts like she don't know shit. And that's what she does. And then
Right.
she waits for them to tell her everything that's going on with her, with me, or whatever. I make her go in with me because she records it all and listens and writes it, and she knows it's not going to be in my head when I walk out, and that's just a fact.
That's good.
But she don't. I mean, I've never got slapped so hard. I was trying to brag on her. I was like, I was just like the radiologist or the lady doing my x-rays and stuff. And she was like, I was like, yeah, this is the best nurse. I said, I got my own personal nurse. I got backhanded when we got in the car. I was like, Mom, what was that for? She says, don't you tell people. She wants nobody to know her training because she legit sits back and listens to the bullshit that they tell her. And then she'll
Yeah.
call them out on it.
Yes.
Carmen says,
Yeah.
no doctors at all in my neck of the woods, Northeast Netherlands. Oh, wow. You have to go to a hospital, but the closest one is an hour away. Shoot.
That is
Oh, they,
ridiculous. Do you have like an urgent care or like a,
I
you
know
know,
what happens with an
a
emergency.
something, a little something?
Let's see. The biggest problem in Canada is a shortage of doctors. It's a very hard job. Burnout is a real thing. Early retirement from burnout, moving to the U.S. to make more money, and then work fewer hours. True that. But we're getting crappy doctors are coming to light more and more, especially about all the COVID stuff that's caused. It's a lot. It's a
Yeah.
lot. It's a lot. Barbie, Canada in many indigenous communities, the healthcare is terrible due to lack of doctors and communities being very remote. Some are hours from the nearest hospital and have to get airlifted if it's an emergency. Wow.
It is true.
That's not good. Yeah. They have to see the problem with their eyes, but it's the best thing for many illnesses. They don't care about mental health or multiple conditions. Yeah, comorbidities, mental health, they don't care. I
No.
mean, I'm just going to tell you straight up, they don't. I fight this every day. It's sad. Okay. Well, mental health in indigenous communities is poorly lacking as well. Psychiatry and therapists are thrown in only a few days a month. That does what? Good. Okay. Yeah, and that MRI is a test that will show if you have a herniated disc or another problem with your spine. It also shows nerves. That's where it does all your nerve readings. X-rays pick up on your bones, and a CT scan picks up on your soft tissue. Yes, absolutely. So if you have like nerve damage, like I did on my neck, that's where they found it was the MRI. And they retire early due to burnout. I bet they do, but so how do doctors get paid over there? Like they don't have to do billing or anything like that? I mean, I don't get it. In diagnostic imaging, different modalities, ultrasound, X-ray, MRI, CT, all detect different things. So the type of thing being looked at determines the test. Absolutely.
Yep.
And it is a misconception that MRI is the top test that will see everything. In some cases, CT and ultrasound are the best. And you're absolutely correct on that because it did not show it on my MRI. But when I was waiting that so long for that CT scan that second time, and we got it and immediately went and seen him, and then I was immediately called back for another MRI. It's because that's where they found the those extra set of ribs I have that I didn't know people had.
On your CT scan?
So yeah, the cervical spine, the cervical
Yeah.
ribs, but it also showed that my whole entire neck was fused and the bone had grew. So it was better because he was scared of the
Well,
MRI.
nothing's
It's just
showing up on
black.
the MRI and all of that showing up
Yeah, it
on
was
the
all
CAT
black. And he was
scan.
like, I was scared of that. I have many steps and evaluations, but yes, I would keep my dignity. Whatever we can do, please let us know. Please. I mean, we may not can do much, but please, please, please. For those with terminal illness, it gives the power and decision to the patient. Well, we don't have that kind of people over here. Quite a few countries cover the medical assistance so peacefully. Yeah, well, probably not United States because, like, why would we? I'm not going to say anything. I'm going to be quiet. I'm going to be good. We don't take care of people when they're alive, much less I'm going to give them any money to die.
Although,
Doctors are
might.
Doctors are people. Some are narcissistic. Some are not. Some bus drivers are not. Hey, I want my doctor to be a narcissistic doctor. I want him to know he's the best in his field. Sorry.
That's right. Believe
Like
it,
they
be
say,
it,
don't
do
put.
it.
Yeah, if that's what you are, then please, whatever you do, please. And no, I was not in the chat, and I'm not taking any more start. I think everything. I just wanted to. Oh, he wanted to use you as a YouTube channel to do at-home physical therapy for the prolapse, even though I had pictures of it exiting by 2 inches. Oh my God, Pope Groomer. The hell is going on here?
What did you
Wow.
say? What did
Oh
you
my
say?
God.
I know.
Where's she? Oh my gosh.
An at-home physical therapy.
I do at-home physical therapy, but I ain't doing no pelvic floor thrusts.
And not on
Sorry.
YouTube.
No. Programmer, I'm sorry. Wow. Shit, I think you got the story of the night. You got the shock of the night.
Yes. Oh, sweetheart.
Sophia, our hospital sent a classmate home with liquid in her belly, saying it's just water. It wasn't water, and acidity caused some damage to her organs. She's, oh my God, what is the deal? Oh, wow.
Oh my goodness.
Yes, y'all, please put Groomer's channel, everybody post your channel. I want to thank y'all. Tip, thanks for being here, Misha,
sure.
and Six, and everybody that's been in. I mean, Pup, thank you for being here. Like, I really appreciate it because there's so much that goes on with. It's not just mental health. Like, I mean, there's so much that goes on with our lives every day, and sometimes we just need to talk about those things because we know they're happening. We're not going to sweep them under the rug. I'm going to call it out because it is what it is. I mean, it's not right and it's not fair, and I am going to call it out. But and you have a voice here too, and that's what we're here for. Everybody to have a voice. And there's some, I'm going to make up. I apologize about the audio. I will make that up probably maybe tomorrow, if not
For the 6th session.
yes, because and it's not long. That section's not long either. I went through, but I wanted to print. I don't have it printed. I've just got it on. I've got the sheets, but I couldn't pull them up on my computer. I was gonna try to do this digitally and highlight it and then present it, and I can't get it open. I don't know. I'm gonna figure it out. I have too many devices. I forget what Apple products don't go with this product. Don't go with this
I know.
product. So it's like crap.
I know.
Okay, so I want to say thank you. I'm going to read this like I said I was going to do. Remember, everybody, growth isn't about changing who you are, but about becoming the best version of yourself. Katie, I will have to look. I haven't been able to get into anything until just a while ago. I don't, like I said, I think I screwed some stuff up, but I'm going to fix it. Brand new equipment. I can't get into anything. I will look, Katie. I got the last one. Actually, let me look over here. Hang on. Let me see. See, something's been throwing everything into spam lately. Wait, that's the one I have.
I'm going to pop off, honey, because I got to go to the ladies' room. But thank you for having me on, and
Thank
thanks
you for
everybody.
being here. I appreciate it. Thank you, Tip, for coming on. Yep, that's the last thing.
Sure.
Thank you. I appreciate you so much.
Sure. Thank you,
I'm going to try to
sweetheart.
find this. Bye. I'm going to try to
Bye.
find this really quick for Katie, though. Katie, I've got the one that I did get that went through was Out of the Night That Covers Me, Black as the Pit from Pole to Pole. That one. I did get that one, but I thought there was another one. I thought there was one that I couldn't, there's one in here I couldn't read. Oh, that's it? Because there's one in here that I thought was like totally in French and I couldn't read it. I was like going, oh, this is a joke, right? I was laughing so hard. Okay, so I'm going to put that one up. I could share that one. Hang on. Let me find it here. Yeah, I had to get a translate into English. Come on, give me this one. Okay. You're not going to be big with. Oh, yes, you are big enough. Haha. Share. Why did I do that? Oh my God. Just, what did I do? What did I do? Bad stage. There we go. This is what Katie sent me, and I really like this. Out of the night that covers me, black as the pit from pole to pole, I think whatever gods may be for my unconquerable soul. In the fell clutch of circumstance, I have not winced nor cried aloud. Under the bludgeonings of chance, my head is bloody but unbowed. Beyond this place of wrath and tears looms but the horror of the shade, and yet the menace of the years finds and shall find me unafraid. It matters not how straight the gate, how charged with punishment the scroll. I am the master of my fate. I am the captain of my soul. I really like that. Thank you for sending that to me. And I truly mean that. I appreciate it, Katie. Yes, I did, because I was like, I have to translate this. It tried to do it in Spanish and in French. I was like, no, please don't do that. But I think that's all I've got right now. Thank you, mods, for being here. Thank you all for being here. Y'all done a great job, Red. Thank you so much for sticking with me. Probably make up the chapter 6 tomorrow. That's going to be my 10th plan. Okay, guys. Thank y'all. Y'all have a great night. Thanks for coming back too. I appreciate y'all. I really do, and I appreciate it. Have a great day. I mean, a great night or day or wherever you're at.